It's time for DocTalk Radio, brought to you by Gilbert Hospital and Florence at Anthem Hospitals. I'm Dr. Ann Borick, board certified in internal medicine, and I'm here to keep you up to date on the latest information pertaining to your health and well-being. Welcome to DocTalk Radio, sponsored by Gilbert Hospital and Florence Hospital at Anthem. Joe, how are you doing today?
Been another week. Good.
It's been a busy week. Yeah, it's just been a very, very busy, a lot of flu. Hospitals are full. We're just really
I imagine I'm seeing that all over on TV, and I guess it's an epidemic now, huh?
It really is. You know, last night I did a spot on Channel 5. They called, and there's a new study out talking about cough, and showing that, you know, the cough can linger for up to 3 weeks. And, you know, we see that. We see people come in, and a lot of times, if it doesn't go away within, 5 days or 7 days, people tend to panic and think, well, they need to be on an antibiotic. When in effect, it's not uncommon for a cough from a viral or flu symptom to linger for up to even 3-4 weeks. And I think that's something that, really people need to understand, that sometimes it's best to just be, to be patient, let time take its course and keep hydrated. But, sometimes just taking antibiotics on antibiotics really is not the best thing to do.
Well, you know what I'm surprised to see? And I've been doing some outside events lately, and there's always usually alcohol involved. Mm-hmm. And you see the people hacking and coughing and taking an antibiotic and having a cocktail, like washing it down with a a margarita.
Right.
Isn't there some kind of effect on that? Doesn't that make it neutral or something? Doesn't it ruin the antibiotic?
It can. There's some studies and talk about how it can inactivate the antibiotic. So it's not a good idea really to drink alcohol when you're on an antibiotic. It just affects the immune system, and it tends to kind of weaken the immune system. So if you're fighting infection, alcohol is probably not the best thing to do. It dehydrates the body. So just in and of itself is not a very good idea. And
if it's a cough, if they're a smoker, it's probably best to take a couple of weeks off at least, right?
Yeah, well, the first thing when we're talking in a smoker is to really try to back off on the cigarettes, because when you think about it, if you're dealing with a bronchitis, an infection, a pneumonia, and you continue to smoke, it's literally like taking an open wound and putting dirt in it. The body just won't heal the way that it normally would heal if you continue to smoke, because what happens is smoke decreases blood flow to the area with healing. It causes vasoconstriction. It's not a good thing. So many times I have patients in the hospital that I admit for pneumonia, and they want to go out and smoke.
Oh my God! Come on.
And it just makes no sense.
Well, I was telling Marie yesterday. I said, I wish they had some kind of magic cure for these weird... you're addicted. These are addictions, just like eating. I said, man, it would be just, I've never smoked, drink, any of these things. But, man, I wish there was an easy thing I could, take a vapor, burger.
Like a fix.
Take a vapor, give me a steak and a vapor cigarette, and I'll do that.
What we use is a nicotine patch, a lot of times, just to kind of give that nicotine, because it is an addiction. It's a physical addiction.
What I've been seeing lately a lot are these, coupons in magazines, like $25 for $150. It's called the Blue System. And they're little vapor cigarettes.
Like the vapor cigarette?
They're really pushing these. Are those better? I guess they're better for secondhand smoke, right?
It is better for secondhand.
Although, can you breathe in vapor?
That's the problem. And I think that there can be some toxic long-term effects. It hasn't been around that long. So the question is, what are the effects, 5 years down the road from really exposing...
It could be just as bad.
Exactly, to exposing your lungs and your body to that. I don't think it's very good. And that's that's something. When we talk about cough, there's other things that can cause cough, and I think it's important to even mention it. For those of you listening, we have a whole host of different things we want to talk about, but I would love to hear from you. If you have any questions, call in 480-745-1033. We can just open the lines and just chat and talk and answer any questions. But cough. A lot of people don't think about it, but acid reflux can be a cause of chronic cough. So, if you have the symptoms to go along with a virus, flu-like upper respiratory infection, fevers, that kind of thing, and you have a cough, usually we can deduct that cough is probably from the underlying viral infection. But once that goes away, and if a cough lasts for, 3 months, 4 months on end, There are other things that I think it's important to look at. Number one, do you have acid reflux? Is that something that, because people don't realize that acid reflux can actually go all the way up, and it can reflux up into actually the trachea, and it can cause an irritation and chronic cough. We recommend in people that have that to kind of elevate the head of their bed at night so that acid reflux doesn't get worse when you lie flat, those kinds of things.
I learned something a little while back. I had a really, I'd consider it chronic, dry cough. And then my dog came up with valley fever, and I thought, I for sure have contracted valley fever. Getting tests and nothing, and bronchitis and pneumonia and nothing. Well, then I learned that lisinopril
absolutely, that was my
gives you a dry cough. And I mean, I went through this for years. I saw multiple doctors, and I caught it on your show one day. I'm like, what?
Yeah, I remember that it was something that really kind of, the light went on.
And that was really landmark to me, because I thought, I was starting to go, man, am I sick right now? Up
to 30% of the people, 3 out of 10 people who are on what we call ACE inhibitors, lisinopril, Zestril, Prinavil, Vasotec. I mean, that class of medicine could potentially cause a chronic cough, and it's reversible.
And it's a pain in the butt.
It is. It can be a very nagging, chronic, irritating cough, and once you stop the medicine and switch to a different type of medicine, the cough goes away. The interesting thing about it is oftentimes we treat people who have high blood pressure, or, for example, if you're a diabetic, with the ACE inhibitor kind of medication, because there's a protective effect that it gives, particularly diabetics. The ACE inhibitor medicine actually tends to protect the kidney from developing diabetic nephropathy type symptoms, which are very important to protect, in particularly diabetics. So it kind of decreases the pressure that goes through the kidney, and it protects it. So anytime I see a diabetic that needs to be treated for high blood pressure, the ACE inhibitor medicine is really the drug of choice. Now they actually have a second generation that gives you that protection. It's called an ARB, without giving you the side effect of the cough. And so that's very important to know for those of you listening. Let's say, for example, if you're a diabetic and you're on an ACE inhibitor and you have a cough, to talk to your doctor about starting the second generation or the newer, more improved ACE inhibitor that gives you the protection without the side effect of the cough. And
is that nice? I'm going to have to check that out.
Absolutely. Cozar, Hyzar, there's some of the newer medications.
And they're still as effective?
Absolutely. Actually, even more so. So, that's important. And while we're talking about medicines, there are certain medications that have side effects. For example, the beta blocker. That's another class of medicines that we use for heart disease, for high blood pressure, metoprolol, atenolol, Coreg. There's a whole host of beta blockers. It is something that is indicated in people who, it's protective for people who have underlying coronary artery disease. But interestingly, people who have, for example, psoriasis, beta blockers can really flare the skin changes and make psoriasis just, go haywire. And that's important to know. So, it's kind of important to have a good handle on the whole complete medical history when you're starting new medications, because there can be some interactions and it can unveil maybe symptoms that you already have. I want to just talk a little bit about something that this past week we had a very interesting case, something called jaundice, painless jaundice. Now, jaundice is when the skin turns this yellow tint, and it's due to elevated bilirubin in the blood. And sometimes people who have gallbladder problems, if a gallstone comes out of the gallbladder and kind of lodges itself in the duct, it causes kind of a blockage. And the whole purpose of the gallbladder is really a bag that holds bile. And it sits underneath where the liver is, and there's a connection, to the liver, and then there's a connection that goes across to the pancreas. Well, sometimes if you have a gallstone that somehow dislodges itself, it gets out of the actual gallbladder and goes into the neck of the duct, it can cause a blockage, and it can cause a backup of bile. And the way that we see that is a blood test. The bilirubin is a blood test that we can measure. And then over time, the liver enzymes start to go up, and sometimes you can develop a pancreatitis from it. And all of that is related to oftentimes a stone that gets outside the gallbladder. Now, interestingly, people ask me, well, is it possible to have that if I don't have a gallbladder? And the answer is yes. Sometimes, if you've had a gallbladder removed, it's possible to have a retained stone. And during gallbladder surgery, a lot of times the surgeon will do a cholangiogram where they put dye in and they kind of see and make sure that it flows and there's a nice, very smooth appearance of the common bile duct to make sure that there's no blockage or make sure that there's no retained stone. But sometimes it is possible to have a stone and it can cause this bilirubin to be elevated. And we call it jaundice when the bilirubin goes up, too high. Do you have a question, Joe?
Yes. Jenny is our first caller from Santa Fe, New Mexico, who said she has a slightly compromised immune system, and she's flying to New York on vacation, and she is concerned about the closed cabin airspace and getting the flu while she's on the way. She said once while going through a metal detector, taking her shoes off, she got a bad foot infection.
Oh, wow.
So now she's paranoid and about going through and wants to be cautious with the airport and the planes.
Any closed space, absolutely, Jenny. I share
that is scary.
I share your anxiety. It is, especially this time of year. The flu is, we're at the height of the flu season. Things that you can do would be to really just try to, keep your immune system as healthy and as beefed up as possible. Vitamin C, stay hydrated, get good rest. Beyond that, there's really not a whole lot to do. Would a mask help? Sometimes I guess that would be something, but honestly, there are studies that show that people who wear a mask, sometimes the mask itself becomes what we call a fomite. And I'm going to explain what a fomite is, but it tends to attract, pathogens and viruses and even bacteria.
That makes sense.
And then you actually are exposed to it, and that's not a good thing. Masks in public are really, and I'm talking about the mask over your mouth to really protect against, being exposed to infection, is really recommended for people who they themselves are immunocompromised, would be one. If somebody's on chemotherapy and they really have no immune system, we recommend that. But also for people who already have the infection, to prevent them from exposing other people is really when it's indicated. So my recommendation is, number one, I probably would not recommend that you wear a mask unless you have a real severe immunocompromised condition. And just do the best you can to keep your hands, wash your hands, try not to be exposed to anybody that's sick and sneezing and coughing and that kind of thing.
My concern is when you go to the dentist or the doctor and they're a little sick. What do you do?
It's true, Joe.
What do you do sitting there in the chair with your mouth open with people? Even with masks on, people sneezing, that's like, wow.
That's why the American College of Physicians, the ACP, came out with this mandate that healthcare workers are mandating that we get the flu shot. So anybody that is a healthcare worker really has to abide by that recommendation. And today, even as we speak, if there are healthcare workers, nurses, even physicians in the hospital that didn't get the flu shot, there are policies in place in certain hospitals where they have to wear a mask just to protect their patients. And so, it's very real. I said fomite. Fomite is a word that I want to explain, and I don't know if any of our listeners out there know what a fomite is. But a fomite is what we refer to as an inanimate object that potentially can harbor infection and be the source of transmitting infection. For example, a phone, even this microphone. My stethoscope can be a fomite because anything that is an inanimate object that we touch, that we use, especially in the hospital, it's important to make sure that the bed rails, if you're being admitted into the hospital, are cleaned. The telephone handle is clean. Those are where infection is transmitted. If you're in the supermarket and the buggy, for example, that's a perfect place to harbor infection. And so you touch that, and then you touch your mouth, and that's how it's transmitted. So that's just important to keep in mind. So if you're traveling this season, just keep that in mind. Make sure that you maybe even carry handy wipes, those kinds of things to try to keep yourself protected. Ice machines. Before the show, Joe and I, we were talking about different things that can potentially transmit infection. And for the most part, we were talking about air, breathing in somebody coughing or sneezing or touching something where you touch your mouth. But it's possible to actually ingest something that possibly can transmit infection. And just be aware that sometimes ice in restaurants, when we go out to different restaurants and so forth, that's now been in the news where we're hearing some talk about contamination of the ice machine that may not be cleaned. So it's just something to kind of keep in mind. And
this kind of plays into that, actually. It's not the ice so much, but Jessica from Abilene, Texas says, I get very sick, and I believe it was from a soda fountain refill in a gas station. She says, I kind of really noticed after I was sick and got better that people take the refill cups, and I've noticed this.
I have too.
They actually drink out of it, and then they touch the thing with them. Sometimes, and she said this, sometimes the liquid is actually submersed in the thing that's filling it.
And that's not good.
That's gross.
Or if you have...
And you are right, Jessica.
Yeah, absolutely. Even one step beyond that, if you have a straw, and you're drinking out of the straw, and then you put it under there, and that straw that has your saliva...
These things can't be clean.
Absolutely. I mean, these are things that...
Oh, my God.
That it's really about awareness, too, so that if you see that... say something. If it's a server that's going...
But you know what? You're always going to have that. There's always going to be somebody to walk in and do that. Like at buffets, they have those sneeze guards. Why do they have those? But still, you got kids going up, grabbing stuff and putting stuff back, and people dumping stuff off their plates. I mean, I know it sounds gross, but I've seen it.
It's true.
And it is like, whoa.
And, the message, the purpose for, DocTalk Radio is to really increase awareness.
Yeah, right.
And I think that's, that's important to when you drink out of a soda can, how many times... do we drink out of the can and not really clean the top? I do it all the time. And I, when I clean the top is when it's physically dirty. Right. You're like, wow, that's really dirty. Let me clean it. But what about when you can't see it? Exactly. And so, I've had patients who we've diagnosed H. pylori, Helicobacter, pylori, which is a bacterial infection that kind of harbors and kind of sits in the intestinal, mainly in the stomach, that increases the risk of, peptic ulcers and so forth. And a lot of times people say, well, how do I get that? And, and I've used that example. Sometimes you just don't know, but, you drink out of a can or something that maybe, has a bacteria on it, and that's how you get it. I have got a phobia that I need cleared up right now. What's that, Joe? Double dipping. Oh, it's probably my number one, and this is really weird when I say it's right up there with being afraid of public toilets for me. If I go to a party, and I even think there's somebody there that may have the inclination to double dip, normally I won't touch stuff that's out like that. Right. But if I'm feeling bold and I'm like, maybe it's that new, but still you get that double dipper. And I go so far as to tell people. That's good. I'll be like, you know what? Why would you do? And I'm like a weirdo. Like I'm like, why would you double dip? Ha ha, that's really funny, isn't it? Well, you can have it all. Right. At a party that's not even mine, right? Isn't that nice? And that's, it's important to keep it's awareness. Is that dangerous, Dr. Borak? Well, let me know. Let everyone out there, their kids know. What can double dipping do? Well, if somebody has an infection and they're passing it and spreading it, that's what epidemic is. That's with the flu epidemic going on right now, absolutely. I'll bet double dipping probably up the numbers during the holiday. Now, let me tell you, though, the body is an amazing machine. So, we do have an intrinsic, defense system in our body. And you talked about public toilets and that kind of thing. Well, really to just make sure that, in all honesty, I don't want to instill fear in the public because, the body really is designed. We have good bacteria on the surface of our body from the head all the way down to our toes. And whenever we come in contact with, something that is foreign, maybe something that possibly can cause an infection in the body, for the most part, the body has a way of being able to eradicate that, deal with it. That's what immunity is. That's what our immune system is designed to do. It's when our resistance is low. It's when our immune system is not at its peak performance, for example, that we get susceptible to developing infections. So, and that's is it better to sometimes let people double dip? No, I'm not saying that, but I don't want to, have people think that that it could be a life-threatening situation. That it's like homicide. For the most part, the body can really deal with those kinds of things, and I think that's really important to understand. I know we have some calls coming in. There's some other studies that have come out. A big study this week that came out that I actually posted on our Facebook and page was where in women, particularly young women, middle-aged women, when we eat higher amounts of particularly fruits and vegetables, but in particular red and blue fruits, berries, strawberries, blueberries, blackberries in particular.
Red and blue fruits.
It really, the anthracenes, the antioxidant in it has a protective effect, and it is definitely statistically significant where they found that there's a decreased incidence of coronary artery disease, heart disease, in women, particularly women who eat higher amounts of berries. And that's just important, to know. Exercise. We're into the new year, and a lot of people, I'm sure, have made these New Year's resolutions of exercise, weight loss. Study shows that, there's different types of exercise. There's resistant type exercise, there's aerobic exercise, there's anaerobic, there's weightlifting. And the studies, some of the recent research and literature in exercise physiology, research and science shows that if you're interested in losing weight, probably still the best exercise to do is an aerobic type exercise. Walking, brisk walking, jogging, bicycling, those kinds of things. Getting the heart rate up, getting that oxygen moving through the body is probably the best way to burn calories and ultimately, achieve the goal if weight loss is your goal. Now, if, core strengthening is the goal, if muscle toning is your goal, which is different than weight loss, then a combination type exercise with resistant type exercise, the band kind, push-ups, sit-ups, those kinds of things, core exercises are really good to use in combination with the aerobic exercise.
Linda from Cave Creek says, I've had the flu, I believe, and she's been sick for about 7 weeks. 4.5 weeks since she was sick, she hasn't had any symptoms. She's had a lingering cough, which, boy, I've had that at least 3 weeks. Mm-hmm. She says it seems to be getting a little better. Should she be concerned?
Probably not. And that's really what the gist of yesterday's TV spot and the new research and the literature really coming out, that we're seeing a cough that's just lingering for weeks. And as long as you're not coughing up a whole lot of, colored phlegm, yellow, green, tan, especially if it's blood tinged, that would be something that I would recommend. Yes, probably be a good idea to get in to see your doctor. But if it's a dry cough that just kind of is lingering, no fevers, in that case, it's something that probably would be a good idea just to kind of hang tight, keep hydrated, decongestants. A lot of times that lingering cough comes from sinus drainage in the back of the throat. So if you can do something to kind of prevent that, dry that drainage up, if you will, that will really help with the tickling and the irritation of the bronchial tube causing the cough. Now, when is it a good idea to be seen by your doctor with a cough? The answer to that is if you feel short of breath. If at any time in the process of, feeling sick, having the flu or virus, if you feel like you don't have the capacity to take a deep breath, or if you feel winded walking across the room, for example, that may suggest that there's a problem with oxygenation, that you're not getting enough oxygen, at the level of the lung, and that may mean, pneumonia. There may be bronchospasm there. Sometimes people who have asthma, can have those problems, and that would be a reason to be seen by a doctor. In a very small population of people, a virus, upper respiratory type virus, can sometimes attack the heart muscle, and it can cause the muscle to weaken and cause what's called a viral cardiomyopathy, and that can be pretty serious. It is something that oftentimes reverses after the illness is over. 3 to 6 months, up to 9 months down the road, the heart muscle kind of recovers, but it's almost like the heart muscle is stunned from the acute viral syndrome. In some cases, it may not reverse, and so that's why, if you feel short of breath, where you really don't feel that capacity that you can, walk across the room without getting winded, then that probably would be a good idea to be seen by your primary doctor. Night sweats are another thing. I always ask my patients, are you sweating a lot at night? Do you feel drenched? Because sweating tends to go along with infection, especially here in Arizona, we see a lot of valley fever, and night sweats, are one of the symptoms that we see. So that would be something, if you have persistent sweats.
And that is not fun.
It's not fun. And what happens is you lose a lot of fluid. There's a lot of insensible fluid loss. And a lot of people don't think about that, but if you're sweating a lot, you have fever, maybe you're not drinking as much as really you should, you can become very dehydrated, and that would be a reason to get in to see your doctor.
Gene from Little Rock, Arkansas says, I have moved to stevia over diet sugars. Is this a huge benefit for my health? Should this give me the energy back that I have needed?
It probably, I don't know if you're diabetic or what your other medical history is, but, probably, hopefully it will. The diet sodas and a lot of the stuff that we really don't know what's in, and some of them may be more apt to have carcinogen effect and so forth. To avoid that is probably best. And so that would be my recommendation at all costs, to try to avoid diet sodas and a lot of the artificial type sweeteners if possible.
Here's a good question. Is this a myth or not? Leaving the gym without being totally dry causes you to get sick.
That's a great question, and I'm really glad whoever called in or sent that question. No. And let me kind of explain. When we talk about being exposed to the cold air, or going out with your head wet after taking a shower or sweating at the gym, the only thing that I can think of in terms of working out, sweating a whole lot, at the gym and then going out, is when you're sweating, the pores are open. There's a vasodilation that occurs on the surface of the skin when you work out, especially if it's a high intensity workout, hot yoga, that kind of thing. If you're sweating and then you go outside into the cold air, there can be, I don't want to say a risk, but certainly the only thing that causes infection is bacterial, viral, a pathogen. So being exposed to cold is not going to cause that. However, when the vessels are dilated, are we more apt to be exposed to, when we're exposed to it, if we're exposed to it, coming into the body and causing a problem? It's possible. That's why we always recommend a cool down session for at least 15 minutes to give the body time, not only the heart rate come down, the breathing, the respiratory rate, but to give the surface of the skin, the capillaries, time to equilibrate and go back to the normal state instead of being vasodilated. Because if you do, in fact, come in contact with a pathogen, a virus, or something in the air, or whatever, you're more apt to be able to protect yourself against it. But simply, and I want to make sure that people hear it, simply going outdoors with a wet head or in the cold is not in and of itself a risk for developing pneumonia. I mean, there's this old, a lot of people think, well, you're going to catch pneumonia if you go out, with your hair wet, and that's not the case at all. The only thing that causes pneumonia is infection. It's not the cold air that does it.
And hang on one second, Clifton, because that brought me to a question that I have. Mm-hmm. So is it better to keep your house cooler or warmer, as some people do out here, being in Arizona? I like to keep my house 72 year-round. Is there a medical benefit to this?
I don't think there is.
Really?
I really don't. I think people who have, for example, if you have cold-induced asthma, for example, and it's more humidity related. So let's say, for example, people who have reactive airway disease, asthma that is brought on by cold, dry air, it's probably a good idea to have a humidifier. It might be good to keep the temperature a little bit warmer for that person.
I always thought bacteria bred in higher temperatures, so if you keep your house warmer, it's like a sick pit,
Not really.
Wow.
As long as you have good ventilation, it really, there's not as far as I know, there's no study saying that, in the wintertime we should keep our temperature a certain level. As far as I know, that doesn't exist.
Oh, that's good to know. Mm-hmm. Clifton from Tempe says, is there any negative effects that you know of to smoking cigars? I enjoy them, and I don't inhale.
Absolutely. Cigars.
Even though they don't inhale.
Absolutely. I mean, it's impossible, and I know this may sound kind of strange, but it's impossible to not get something into the lung when you're smoking, even if you don't inhale. Secondhand smoke is a perfect example. You're not. We're just kind of being exposed to it, but by just being in the atmosphere of the smoke tends to, be able to diffuse into the body. And that's not good. So, cigars there's a high incidence of lung cancer with cigar, just like there is with cigarettes. High incidence of the side effects that we see in cigarettes as well as with cigars. So, unfortunately, when we say no smoking, it means all of the above, including cigars and cigarettes and pipes and those kinds of things. Why is smoking so bad? In the body, we have the red blood cell there's 4 different areas on the blood cell that attaches to molecules. And it's the oxygen molecule that really is carried on the red blood cell in the body. That's the purpose of the blood cells, to carry oxygen and nourish the body, exchange oxygen and then remove carbon dioxide and carry it out. When we smoke, when we're exposed to smoke, whether it be cigarette smoke, cigar smoke, pipe, any kind of tobacco type smoke, what happens is the affinity for the red blood cell wants to hold on to that carbon monoxide more than it wants to hold on to the oxygen. And because of that, we literally are starving our bodies from the inside out, because the red blood cell has the affinity, meaning that if it had a choice to choose either the carbon monoxide or the oxygen, 40 times more affinity for the carbon monoxide. And so it's really kind of pushing oxygen aside, and we're not getting oxygen flowing in the body. That's why when you look at smokers, there's a lot of different things that when you look at somebody that is a smoker, you can see sometimes a skin discoloration. It's just, it's more of an ashen color, probably due to the carbon monoxide levels in the blood, in the bloodstream. It's not as healthy looking. We know that people who smoke, whether it be cigars or cigarettes, have a higher incidence of aging more quickly. The skin tends to age quicker because it's being literally starved from the inside out. What feeds the skin and keeps the skin healthy is blood, oxygen, little capillaries that go to the skin. And so, when we deprive that, literally the skin tends to not be as healthy, and that's a problem. And it really shows up with wrinkles, it shows up with thinning of the skin, those kinds of things. And I'm sure a lot of people, know what I'm talking about. You can think of, if you think of seeing what long-term smokers look like, you can see that in their eyes and in their skin.
I've developed a dry cough during the show.
You have...
Cynthia Ruiz from Mesa, Arizona. I have really bad sinuses since the 80s. I started using lots of different nose sprays and stuck with Afrin since the 90s. Been using it daily since then. If I don't have it now, I cannot even breathe out of my nose. What do I do? Have I damaged my body?
Yes, and this is a very, very good question.
Actual damage?
Well, it can be, and it's called medicamentosa. What happens is nasal sprays, Afrin, neosporin, what they do, they basically, for a very short-term use, it's fine. 3 to 5 days, it really helps to open up, the sinus passages.
But since the 90s, that's a little long.
Chronic,
every day.
And what happens is it's like a vicious cycle. People who use it, there's an addictive potential, first of all, to Afrin, to,
a physical addiction?
Absolutely.
Really?
The body, the nasal mucosa becomes addicted to it. And what happens is the more you use it, the more dependent you become on it, because it actually causes worsening symptoms. That's why you can't get off of it, because the more you use it, the more your body needs it and causes that constriction.
Oh my
and so
God.
When you don't have it, you feel stuffy. When in effect, if you just give yourself that holiday off, 5 to 7 days off, it'll be difficult to do, but
what does a person like this do?
Well, I mean, it's a real problem. What happens is there's trauma that occurs in the lining, the mucosa of the nasal passage, and I would bet, and I'm not sure what her name was that they called. Cynthia. I would bet that you probably don't smell as good as you used to smell either, because it affects the olfactory. It affects the ability for the cells, the ciliary area inside the nasal cavity, to pick up different odors. And so really it traumatizes it. And anytime I see patients with chronic sinusitis, addicted to Afrin, neosporin, those kinds of things, it's a real problem, and we recommend that we use something maybe oral, whether it be an oral steroid or something to help to get you off of that topical spray. It's kind of similar to people who are addicted to different colon cleansing products, enemas, and those kinds of things. Anything topical over periods of time, it tends to be destructive to the lining, the mucosa of the body. And in the colon, what happens is we just you lose the ability to absorb. And so people who have, chronic colitis and traumatized areas in the sigmoid colon from, chronic laxative use and those kinds of things don't absorb nutrients as well. And so a lot of times we find that they're lacking in, different vitamins and minerals and electrolytes and those kinds of things. So be very, very cautious when, after, 2 weeks max, if you're using something for whether it be, sinus, anything topical, be very, very careful because you can become, addicted to it. But more than that, it can be destructive to the mucosa, to the cells, of the body. That kind of, when we're talking about topical, I want to just bring up something in terms of the skin. There's something called ichthyosis, and in this time of year, a lot of people have very dry, cracking skin, especially on the heels of the feet, our fingernails and so forth, because it is dry. It's the cold dryness of the air causes something called ichthyosis, callus formation. Sometimes the skin can crack, it can bleed, and it can be a perfect setup for infection to enter into even those little cracks in the skin. And we've seen a fair amount of people come in with cellulitis, where infection in the lower leg. And, a lot of times we say, well, is there trauma? Can you think of maybe, were you bit by a spider? And, they say no, but if you look very closely, they have this dry, callousy formation on the heels of their feet or on the balls of their feet, and that's the source of sometimes where infection can come into the body, and it can set up a cellulitis or an infection. So that's something to be cautious about. Joe, I think we have a couple other comments and questions.
Yes, we do, for sure. Let's see. Manny from Sedona says, I get sores under my arms in different places that create heat. Sometimes they have to be drained. They're like cysts that fill up with fluid. I shave my underarms to help avoid the heat. Any idea what this could be? Yeah,
absolutely. This is it's a chronic staph infection, and a lot of times you can develop these little, what we call carbuncles or boils. And what happens is there's little pores, and when the skin gets irritated, it can set up a little infection. It walls itself off, and it develops a little what we call abscess, or almost like a pimple that just kind of gets bigger and bigger, and it festers. People who have a tendency of developing recurrent cysts like this tend to harbor a staph infection. And a lot of times, antibiotics are needed. A lot of times it needs to be drained, where an incision and drainage is needed to get the core out, to get that, that core of that cyst out so that it doesn't recur. Because if you just kind of, drain it superficially.
Squeeze it or?
Yeah, if you well, first of all, it's not a good idea to squeeze it, because what happens is that tends to spread the infection. And I've seen many, many people, come in with what looks like a pimple. It got infected under the arm, in the groin, where it is moist, where it is, warm, and that's where kind of bacteria can harbor on the skin surface. And then if you squeeze it, or if you get even worse than that, like a needle or something, and you're trying to pop it.
You don't want to do that.
You absolutely don't want to do that. I've had patients come
God.
in where it was just a little pimple that ended up being a massive surgery that required a wound vac and
a massive surgery?
I mean, an intensive, major surgery where they needed to go in there and debride the whole skin area, because staph infection can spread, and that's really a problem.
Can that kill you?
In people who have recurrent infections like that, the way we treat it is to treat the underlying staph. People are colonized with that staph. And a lot of times it's either sometimes even an inhaled antibiotic that is given, or just recurrent bouts of antibiotics that are necessary, oftentimes infection or IV. But more than that, a lot of times we just need to get in there and clean that out surgically.
This is common?
It's common. It's not uncommon. Let's put it that way.
Is it more common out here in the Southwest?
Not really. People, we see it most in diabetics, people who are overweight. In the Southwest, where it's warm, where we have where we're sweating a lot and that kind of thing, you just got to be very, very
What do people
cautious.
do to prevent that?
That's the problem.
Nothing much, huh?
There's not a whole lot to do.
Just don't pick them.
Other than sometimes we treat with that inhaled nasal antibiotic that helps to kind of clear the colonization. Because if you're colonized with it, eventually it's going to get in a pore and it's going to set up an infection. And so
people just carry this all the time?
Yeah, they're carriers. That's exactly right. We consider them, strep and staph
Can they
carriers.
spread that to other people?
Well, if you can. I mean, it is, certainly if you pop a pimple and you have that infection exudative stuff and somebody touches that, you don't want to do that because, that's not good.
That can't be safe.
Clean, hygiene, universal precautions is absolutely what is recommended. So that's kind of what our recommendation is.
What about drinking out of cups? I mean, with this flu going around, I just see kids when I go pick up my kids sometimes just passing a cup around a whole group. That makes me ill. That grosses me out.
It's not. I mean, that's not a good idea, especially in kids. They're sniffling and
right.
And, who knows who has a cold or a flu or a virus?
And one of them do.
Exactly.
One of them do.
And so you've got to be very cautious. So people listening out there, it's important to educate your kids, especially this time of year, and especially we should not do that. You don't want that. You don't want to share cups and that kind of thing.
Does that even go to like taking a bite out of somebody's piece of pie?
Well, I mean, we don't want to go too far, but if somebody's sick, you don't want to, that's kind of a stupid question.
That'd be really good pie, huh?
Yeah, but if you're sick, you don't want to share, your food.
Right.
And I think that's just common sense. And I think a lot of what we're talking about is common sense. Well,
a lot of people say, well, I don't have the fever right now, so I'm not contagious anymore. Is that a fact?
Yeah, I think that there's a time when you're first become sick.
And this applies to the flu.
Mm-hmm.
Okay.
When we're talking about the flu, the first probably 72 hours, we're contagious. After that, there's a period of time that really, unless you drink out of it or directly inoculate somebody with your saliva, or chances are you're not going to, just casual contact is not going to be a problem. But again, who knows? We just recommend that you use universal precautions, and I think that's...
How long does this flu incubate, do you know?
5 to 7 days.
So you've had it a while once you get the flu.
That's exactly right. And that's why people say, well, when I get the flu shot, I get the flu. Well, chances are, you've probably had it in your system.
You just get it at the right time.
And it's just the right time. That's exactly right. It's impossible. Well, I don't want to say it's impossible, but, the flu shot is an inactivated dead virus. It's literally not possible to get sick from the actual shot, from the actual virus. Now, you can have a reaction to it, but people who, swear that they got sick after getting a flu shot, chances are their immune system may have been burdened by developing antibodies against the flu shot. But chances are they probably had it in their system for up to 5 days prior, and I think that's kind of important to understand. I want to just kind of go a little away from talking about the flu and so forth, and talk more about stroke and TIA. It's something that we call transient ischemic attack. There's something that is called a patent foramen ovale. Just had a patient not long ago getting their history, and they said, I have a hole in my heart. And for those of you listening, there is such a thing as a hole in the heart. And what happens is, in the septum that separates the two chambers of the heart in the upper chamber, sometimes from development, there's that ovale. It's called the foramen ovale, doesn't completely close. And for whatever reason, blood continues to circulate, and that passageway, or what we call that hole, persists. A lot of times people don't realize it. It goes undiagnosed for years and years until one day they have symptoms of what sounds like a stroke, a transient ischemic attack, whether they are unable to talk, whether they can't move their arm or their leg. For whatever reason, that's a symptom that kind of manifests itself. And lo and behold, in their mid-30s, mid-40s, for the first time, they're hearing about this hole in the heart. And it is possible. And the way we diagnose it is with an echocardiogram. It's an ultrasound of the heart. And an echocardiogram is a great test to really give us information about what's going on from a functional standpoint of the heart. It gives us the muscle function of the heart. It tells us how the valves are working, the integrity of the heart valves, the aortic valve, the mitral valve. But in doing an echocardiogram, there's something that we call a bubble study. And a bubble study is really a neat procedure. And what happens is, when we're doing an echo, which is a very non-invasive test where we just do an ultrasound on the transthoracic, right on the chest, looking at the heart, an IV is in place. And saline is injected through the IV while we're looking at the heart and looking at the blood flowing through the heart. And what happens is saline, which is just the IV solution, contains little, just the saline moving through the vessels. We're able to look at it, and it looks like little bubbles as it flows through the veins when you look at it on the ultrasound. And when it's injected, we can see that bubble cross the septum if somebody has a patent, an open hole in the heart, or a patent foraminal valley. And that's what we call a bubble test. And so whenever I have a patient that comes in with symptoms of like a TIA, oftentimes I'll do an ultrasound of the heart with a bubble study to look to see, is there a patent foraminal valley, because there's a higher incidence of stroke. Now, what do we do about it? Historically, they used to go in and do a procedure, and they would patch that. Just like they do a cardiac catheterization, they would go in through the leg vein, transvenous, and they would do this really unbelievable slick procedure where they would put a patch in place. They don't do that anymore because the studies have shown that it really doesn't make a whole lot of difference, and we just recommend treating with an aspirin every day. And that is the treatment for a patent foraminal valley, an aspirin. But that's just kind of a diagnostic tool that I wanted to bring out because I think that it is more common than people think. And if you hear anybody or talking about a hole in the heart, that's pretty much what it is, and that's how we diagnose it. Do you have a question, Joe?
Cherie from Tacoma, Washington would like to know. She says, I am new to working in the healthcare industry. She's a phlebotomy tech. Mm-hmm. She got poked 5 months ago and has been petrified ever since. The other employees in the office say, oh, don't worry, it happens all the time. Is there anything she should do? I mean, as far as testing now, should she still be concerned after 5 months?
Well, I think there are policies and procedures in place. Whenever an employee is stuck with a needle, especially if it's a dirty needle, it is mandatory in a lot of facilities to be tested for hepatitis, HIV, a lot of the transmittable diseases that are transmitted via blood.
Right.
And so if Cherie, if you've not been tested, that is something that should be done. It's not too late to do that. Hepatitis, a complete hepatitis panel, B, C.
I think she got some tests done, but wants to know how long should she get them.
And that's a good question.
She's just having a hard time deciphering from what the other employees are telling her. Like they're acting like it's a regular thing.
Well, it happens more commonly than we think. The question is, was it a clean stick or was it a dirty stick? And if it was a clean stick, for example, if you were starting an IV on somebody and you know that you had a needle in your hand that was clean, chances are, probably not to worry about.
This was taking blood.
Okay, if it was, after you pulled it out and it was contaminated with somebody else's blood, probably wouldn't be a bad idea at 6 months to repeat the blood work, because sometimes, acutely, if you are infected with hepatitis or HIV, it may not show up, and sometimes, a follow-up is warranted. Go back and look at the history. That's the other thing that maybe should have been done or can be done, and look at the history of the person that's blood you took. Do they have a history of underlying hepatitis C, for example, or HIV? I mean, those are the kind of things that you really want to know. There are some people that actually recommend even treatment early. If you're stuck with a needle from somebody that has known diagnosed HIV or hepatitis C, there are procedures that are followed. And treatment actually is recommended to be initiated just to prevent, because there is a high incidence of possibly contracting that from a needle stick. So yeah, I think that's something that.
But that's a scary thing.
It should be taken.
Really thought about
it should be definitely taken serious. But it sounds like if you were tested and everything was negative, chances are I'm sure you're fine. But I think that if you're still concerned, talk to your doctor, and they may want to just do another set of blood tests just to make sure.
Martha Johnson, Jamestown, Pennsylvania, has a colonoscopy coming up, needs to get one for sure, and is petrified. Is there a different way to get them? Is there another way, like ultrasound?
Actually, there is. And I'm this is a very, very good question. Let me just say that colonoscopies are absolutely indicated. They save lives, period.
And they're painless, right?
They are absolutely painless. The worst part of it, and it's not even bad, is really the prep. Is just cleansing and drinking some different cocktails and so forth that help to cleanse the colon. After that, you go in, they give you some medicine, you're sedated, you go to sleep. 30 minutes later, you wake up and it's totally done, and and you don't feel anything. So to be petrified from that is probably something. If I could assure you, it is a very, very safe. You don't feel anything. Now the question is there another type of test? And the answer is yes. It is possible to do, kind of an MRI-like, test where, where you can actually see the colon and it's a diagnostic test. The problem is if there's a polyp, they can't do anything about it. If you're in an MRI scanner, there's no way that they can do anything.
Right.
So that's not even a consideration. It makes no sense not to actually do the colonoscopy because you need to do the prep anyway for the if you're going to do it an MRI versus a colonoscopy. So why not just do the procedure? If there's a polyp there, they can take it out. Everything is done right then and there, and then you don't have to go back.
That's like double work.
Exactly, it's double work. And I don't even know that it's covered, from a cost standpoint, from an insurance standpoint. So, Martha, let me just assure you that it is probably going to be the easiest thing that you've ever done. In terms of, going and getting blood work is probably more painful than having a colonoscopy. So,
I had somebody email me during the week, and it's kind of weird that they email me, but they should email you, obviously. Mm-hmm. But I got an email talking about a different way to test blood. Now I've heard of the ones you can take them like in the forearm and different places like that, so you don't have to stick your fingers. But I've never heard of a bloodless way. Is there?
Not as far as I know. Now we can assess the oxygen level in blood by a finger probe. And
that's still sticking your.
No, it's just a little.
Oh, just
clip.
a little guy like
it's
that, like
clip,
when you're on a treadmill.
Like
you put that.
Yeah, like
okay.
It's called a plethysmography. But to actually calculate, your kidney and your cholesterol function and the liver function and your blood count and all of that, I don't know of any other way other than
blood
to get a blood sample and look at and do it the way that standard is.
So for people that don't follow up because they're so petrified of needles that they're afraid to poke themselves, which I can appreciate. Is it a bad idea when they get naturally injured and cut to go and grab their kit and go, oh wait a minute, I can avoid this. I got blood coming out anyway.
Well,
does it matter where the blood comes from?
It does. Well, it does. It actually does because when blood hits the air, there's hemolysis occurs and breakdown occurs immediately. So that's why when we go to draw blood, it's actually in a closed vacuum system. You're not going to have the blood be exposed to the oxygen in the air because that can,
thought of that.
It ruins the blood and you really don't get a good calculated information. That's why it's vacuum tight. So if you cut yourself and you bleed here and then you want to take, no, that's as far as I know, that's not.
I mean, I'm sure that a lot of people think that.
Yeah, but that's not anything.
There's no question I've done that in the past.
When you check for your blood sugar, you can actually put it on, and your blood does, touch the air, and certain tests you can do.
Well, that's what I'm talking about.
Right. But you don't want it to set. If it sets for longer than 10 seconds, hemolysis occurs.
And plus, if you fall on your knee and not hit the ground, it's dirty.
It's not accurate.
It's not, is it?
Yeah, it's just not an accurate. It's not an accurate test.
Why do they do fingertips?
Well, it just does. It's a simple.
It's an easy place to go.
It's an easy place to go. Yeah.
Okay.
Yeah. I mean, it's it's important to understand that if you're going to do a test, you want to get an accurate information.
Or it just doesn't do any good.
Exactly. One of my fears when I'm managing patients is to make sure that the information that I'm getting is accurate. I don't want to get information that may not be accurate and then me treat a patient for a wrong reason. Or have somebody feel totally confident that everything is fine when in fact there's something there that needs to be treated. So we've got to really scrutinize the tests and make sure that they're accurate in what it is that we're saying and what it is that we're doing. And I think, that's very, very important.
Wow. Yeah, you know what that's like? It's like going to a yard sale and buying scuba gear. I mean, kind of. You just don't know. It's not fresh and brand new.
If a biopsy is done, there's a certain way. Like if we do a skin biopsy or any biopsy, we were talking about a colon biopsy, it has to be prepped in a certain way to preserve it so that it can actually undergo the accurate testing processes and procedures so that we get the accurate information. You don't want a skin mole to be tested and have it come back normal when in fact it's a very early skin cancer that's going to be ignored and not treated. So, it's very, very important to make sure that there's no sense of security that is not accurate. We've got to be very diligent in making sure that we get accurate information and act on it and treat it appropriately. Because otherwise, if you leave something untreated, then it defeats the whole purpose of preventative medicine. And I think that's the purpose. Talking about preventative medicine, there are certain things that women and men are to do in order to, and why is it important to, step into a preventative medicine arena? Because we know from studies in the past that if we do certain things, it actually saves lives. There's no doubt about it. Mammograms, we know for a fact that if you find something in the breast early, that it is absolutely curable. Same thing with the colon. Same thing with the prostate. Now, in men, it's important to get a prostate exam and do those things. Cholesterol, it's important to get a snapshot to know where are we, because that can certainly lead to heart disease and bad outcome. Do you have a question, Joe? Yeah, this is an interesting one here. Jerome from Manning, West Virginia, says his kids continually get hurt and falling down and whatnot. And he's a big advocate on using neosporin, but his doctor said, you know what, dude, it's not really an antibiotic. It's just to keep the area kind of moist and good, but it's not it says antibiotic right on it. How is it not? It is an antibiotic. There's no doubt about it. Polysporin. Is it a strong one? Well, it's over the counter. It's not as strong as an oral antibiotic, but for topical, superficial skin abrasions, absolutely, neosporin, polysporin is absolutely. I wonder what his doctor meant by that. Yeah, I don't know. I think, again, I think we have to be careful and cautious that you don't want to treat something that may need more treatment, because it can become worse quick, especially when you're dealing with infection. But I'm not sure but polysporin and neosporin, if you're asking me if it has antibiotic, absolutely, it does. And in people who are allergic to certain antibiotics that use that, they can develop a reaction to it. You know? Is that something where if you continually use that throughout your life, you can become immune to it? It's not that strong. I mean, it's not systemically taken. And that's a very good question. Immunity occurs systemically. Now, topical, when you use something on the skin, is it possible that it's not going to work anymore over time? I'm not so sure that we really develop topical immunities. You can develop what we call atopic dermatitis, where, again, anything that we put on the skin or inside the body over and over and over again, it can affect the cells, just like we talked about the nose spray or the laxatives. It can affect, the mucosa. Same thing with the skin. If you do something and you scratch your skin over and over again every day, it's going to cause trauma to that area, to that skin, and it's going to become irregular, and it's not going to be as protective as skin as it can be. And when those cells physically change, is that how cancers That's exactly occur? Right. You can develop a little mutation, and you can develop a higher incidence, especially if you're then exposed to sun and those kinds of things. So constant trauma, whether it be to the skin, to the nose, in the colon, anywhere, it can be, it's not a good thing. And I think that's just the message, anything in moderation. So if you do have a superficial abrasion and you skin your knee, is it okay to use polysporin? Yeah, I think it's fine. After 3 days, if it doesn't heal, then it's something that you want to maybe talk to your doctor about. And I know we're encroaching the end of the show, but one last thing I'd like to mention. When you go to grocery stores, it's not a bad thing to wipe the cart down. Don't feel weird about it. Don't feel crazy. I mean, there's babies right before you drooling and spitting and snot coming out of their nose on it. And absolutely. Some people are embarrassed to take the sheets like they're going to be like, phobics or whatever. But so what? I always wipe them down. Protect yourself. Do whatever you need to do. I've wiped them down and look at the sheet and it's like black. It's. Yeah. Plus, all the carts would be real clean then, right? Exactly. That's great advice. That's a big job to do all at once, wipe every cart down. But if everyone wipes one down, imagine. Right? Yep, absolutely. I can't believe we're at the end of the show already. Amazing. Yeah, great questions. I think that, I love to hear from people calling in. Don't be afraid to come on to the Facebook page. Check out DocTalkRadio.com. Next week, we're going to have a guest. We'll be talking about just some really great ideas about how we can reach out to the homebound and people that need help. There's some different agencies in place to do that, and so we'll be talking about that, and we'll see you next week. All righty. This concludes Doc Talk Radio with Dr. Ann Borick. Till next time, I wish you health, wellness, and many blessings.
DocTalk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.